Every year, tobacco claims the lives of over 8 million people worldwide. That's more than the population of New York City. Despite these staggering numbers, tobacco use remains legal and widespread. The question is why? Globally, there are approximately 1.25 billion adult tobacco users. This represents about 1 in 5 adults. The economic cost of smoking is over $1.4 trillion annually, including healthcare expenditures and lost productivity. In the United States alone, smoking-related illnesses cost more than $300 billion each year. This includes nearly $170 billion from direct medical care and more than $156 billion in lost productivity. So why can't countries just ban cigarette smoking all at once? Our journey begins thousands of years ago with the indigenous peoples of the Americas. Tobacco was an integral part of their culture, used for medicinal purposes, spiritual rituals, and social ceremonies. The plant was considered sacred and was often used in the offerings to deities and during important tribal events. The story of tobacco took a significant turn in the late 15th century when the European explorers such as Christopher Columbus arrived in the New World. They encountered indigenous peoples using tobacco and were intrigued by its effects. Columbus and his crew were among the first Europeans to observe and document the use of tobacco. Upon returning to Europe, these explorers brought tobacco with them. Initially, it was a novelty enjoyed by the elite. Jean Nicot, the French ambassador to Portugal, is credited to popularizing tobacco in France. In fact, the plant's scientific name, Nicotiana, is derived from his name. By the mid-16th century, tobacco had spread across Europe, becoming a fashionable pastime among this aristocracy. As demand of tobacco grew, European colonists established plantations in America, particularly in Virginia. Tobacco quickly became a cash crop, driving the economy of the colonies. It was so valuable that it was even used as a currency. The labor-intensive nature of tobacco farming also contributed to the rise of the transatlantic slave trade, as enslaved Africans were brought to work on the plantation. By the 17th century, tobacco had become a global commodity. It was traded extensively and its use spread to Asia and Africa. The introduction of pipe and later the cigar provided new ways to consume tobacco. Smoking became a common habit among people in all social classes. Then came the Industrial Revolution in the 19th century, which marked a turning point for tobacco. The invention of cigarette-making machines by James Ponsac in the 1880s revolutionized the industry. These machines could produce cigarettes at an unprecedented rate, making them more affordable and accessible to the masses. This led to a significant increase in tobacco consumption.
What cigarette do you smoke, Doctor?
And by the early 20th century, smoking had become deeply ingrained in many cultures around the world. It was portrayed as glamorous and sophisticated in advertisement, movies, and pop cultures. Celebrities and public figures were often seen smoking, further normalizing the habit. However, the mid-20th century brought a shift in perception. Medical research began to reveal serious health risks associated with smoking. In 1950, British researchers Richard Dole and Austin Bradford Hill published a landmark study linking smoking to lung cancer. This was a pivotal moment in public health, as it challenged the previously held belief that smoking was harmless. Public health campaigns emerged, aiming to educate people about the dangers of smoking. Government and health organizations launched initiatives to raise awareness, including graphic warning labels on cigarette packs and public service announcements. Despite these efforts, smoking remained prevalent due to its addictive nature of the nicotine and powerful influence on the tobacco industry. The history of tobacco is a complex tale of cultural significance and economic impact and evolving public health awareness. Understanding this history is crucial as we explore the reasons why tobacco use persists today and the challenges we are facing to achieve a smoke-free world. Let's take a look at some of the current data on tobacco use. According to the latest estimate from the WHO, there's approximately 1.25 billion adult tobacco users worldwide. This represents about 1 in 5 adults globally, a significant decrease from 1 in 3 adults in 2001. Despite this progress, tobacco use remains a major public health issue. The prevalence of tobacco use varies significantly by region. The WHO Southeast Asia region has the highest percentage of population using tobacco at 26.5%, followed closely by European region at 25.3%. Interestingly, tobacco use rates among women in the European region are more than double the global average and are reducing much slower than in any other regions. In terms of health impact, tobacco use is responsible for more than 8 million deaths each year. It includes about 7 million deaths from direct tobacco use and around 1.2 million deaths from exposure to secondhand smoking. The health consequences of smoking are severe, including lung cancer, heart disease, stroke, and chronic respiratory diseases. The economic burden of tobacco use is also staggering. The global economic cost of smoking is estimated to be over $1.4 trillion annually, which includes healthcare expenditures and lost productivity. In the United States, smoking-related illnesses cost more than $300 billion each year, including nearly $170 billion for direct medical care for adults and more than $156 billion in lost productivity. Efforts to reduce tobacco use has shown some success. For example, Brazil has seen a relative reduction on 35% use since 2010 after implementing comprehensive tobacco control measures. The Netherlands is also on the verge of reaching 30% reduction target. However, the world is projected to miss the voluntary global goal of 30% reduction to tobacco use by 2025, achieving only a 25% relative reduction. It's not bad, at least we're trying.
This 2-year-old from Indonesia has developed a very bad habit.
One concerning trend is the use of tobacco and nicotine products among youth. Surveys consistently show that children aged 13 to 15 years in many countries are using this product. Protecting future generations from tobacco industry interference is crucial to ensure that tobacco use continues to decline. The big question is, why can't we ban it? One of the most significant barriers of a smoke-free world is the addictive nature of nicotine. Nicotine is a highly addictive substance found in tobacco. It stimulates the release of dopamine in the brain, creating feelings of pleasure and reward. This makes quitting smoking extremely difficult for many people. While there are effective smoking cessation aids, such as nicotine replacement therapies, medications, and behavioral support, access to these resources can be limited. In low and middle income countries, the availability and affordability of cessation aids are often inadequate, making it harder for smokers to quit. In addition, tobacco farming and manufacturing are significant contributors to many economies, especially in low and middle income countries. In regions like Africa, Asia, and South America, tobacco cultivation provides livelihoods for millions of farmers and their families. The crop is often more profitable than alternatives, making it an attractive option for small-scale farmers. For many of these farmers, tobacco is not just a crop, it's a way of life. Generations have relied on tobacco farming to sustain their communities. This economic dependency creates a complex situation where banning tobacco outright could lead to severe economic hardship for these families. Moreover, one of the manufacturing side of this is the tobacco industry is a major employer. Factories that produce cigarette and other tobacco products provide jobs to thousands of workers. In the United States alone, the tobacco industry generated approximately $11.26 billion in tax revenue in 2022. In the UK, tobacco taxes bring in about £12 billion annually. This revenue is crucial for funding public services and infrastructure. The economic importance of tobacco has given industries considerable political influence. Tobacco companies have a long history of lobbying to protect their interests. They spend millions of dollars each year on lobbying efforts to influence legislation and prevent implementation of strict tobacco control. These tobacco industry's tactics have been well documented. They have used misleading advertising, funded biased research, and even targeted vulnerable populations to maintain their customer base. Take an example. In the European Union, the industry has been known to commission and promote its own research to cast doubt on the scientific consensus around tobacco and to postpone the implementation of new regulations. Another powerful thing is advertising has been a powerful tool for the tobacco industry. For decades, tobacco companies use glamorous and sophisticated imagery to market their products. Celebrities and public figures are often seen smoking in advertisements, movies, and TV shows, further normalizing the habit. Despite growing evidence of health risks associated with smoking, the tobacco industry has fought hard to resist regulation. They have challenged anti-smoking laws in the court, funded political campaigns, and used their own economic clout to influence policymakers. For instance, in Australia, about half of the people involved in tobacco lobbying held positions in the government before or after working for tobacco industry, creating a revolving door that helps the industry shape public policies. Furthermore, economic barriers further complicate this issue. Implementing comprehensive tobacco control measures requires substantial resources, which can be a challenge for many countries. Additionally, the loss of revenue from tobacco taxes can be a significant concern for governments. We're all aiming towards a smoke-free world, but the question is, what are we doing currently to aim to that? What are our goals? What is our country doing? I'll probably capture a few, especially the US, the UK, and Europe. Some of the efforts to reduce tobacco use are being implemented worldwide, with various countries adopting comprehensive strategies to tackle the public health. Let's take an example of the United Kingdom. The UK has been a leader in tobacco control with the goal to make England smoke-free by 2030. This means reducing smoking prevalence to 5% or less. One of the key strategies includes high taxation on tobacco. In 2022, the UK government collected approximately £12 billion tobacco taxes. In 2016, the UK introduced plain packaging for cigarettes, removing all branding and requiring standardized packaging with graphic health warnings. These measures aim to reduce the appeal of smoking, and especially among young people. The UK also invests heavily in smoking cessation services. The government has committed an additional £70 million annually to support local authorities-led stop smoking cessation, and £45 million over 2 years to the Swap to Stop scheme, which provides free vape kits and behavioral support to help people quit smoking. In October 2023, the UK announced a new plan to create a smoke-free generation. This includes legislation to prevent anyone born on or after January 1st of 2009 from being legally sold tobacco products. This bold move aims to protect future generations from the harms of smoking. Now let's fly to the US. What are we doing there? In the United States, the CDC leads national efforts to reduce tobacco use through national and state tobacco control program. This program supports evidence-based strategies to prevent initiation, promote cessation, and reduce exposure to secondhand smoke. One of the most effective measures has been the implementation of comprehensive smoke-free policies. As of 2024, 28 states and the District of Columbia have enacted statewide free laws that prohibit smoking in all indoor areas of workspace, restaurants, and bars. Increasing the price of tobacco products through taxation is another key strategy that the US is employing. In 2022, the federal excise tax on cigarettes was $1 per pack, and many states have additional taxes. For example, New York has the highest state cigarette tax at $4.35 per pack. These taxes have been shown to reduce smoking rates, particularly among youths. Public health campaigns such as the CDC Tips from Former Smokers campaign have also been highly effective. These campaigns, which features real people suffering from smoking-related diseases, has motivated millions of smokers to try to quit. Since its launch in 2012, it has helped over 1 million smokers quit for good. Now, what is happening in Europe? You remember we said the European region is one of the biggest in percentage of smokers. In Europe, the Tobacco Products Directive, TPD, is a key piece of legislation aimed at reducing tobacco use across EU member states. Implemented between 2016 and 2021, the TPD includes measures such as banning methylated cigarettes, enhancing pictorial package warnings, and regulating e-cigarettes. Several European countries, including France, Ireland, and Hungary, have adopted plain packaging flows similar to those in the UK. These measures are aimed to reduce the attractiveness of tobacco products and increase the effectiveness of health warnings. Many European countries have also implemented comprehensive smoking bans in public places. For example, since 2011, Spain has banned smoking in all enclosed public spaces, including bars, restaurants. These policies help protect non-smokers from secondhand smoke and create a social environment that discourages smoking. Finland has set an ambitious goal to become tobacco-free by 2030. aiming for a smoke prevalence of less than 5%. The country has implemented a range of measures, including high tobacco taxes, extensive public health campaigns, and strict regulations on tobacco advertisement and selling. So what can we do? As individuals, we can support tobacco control measures, educate ourselves and others about the dangers of smoking, and encourage those around us to quit. As a society, we must continue to push for stronger regulations and support those who are most affected by tobacco use. Thank you for joining me on this journey. If you found this video informative, please give it a thumbs up and share it with your friends. Let's work together towards a healthier smoke-free world. And don't forget to subscribe to our channel for more insightful content.